using nebulizer and metered dose inhaler with spacer. Learning objectives. By the end of this video, the participants will learn various parts of a nebulizer and metered dose inhaler MDI with spacer. Skills required for correct use of the nebulizer for infants and children. Skills required for correct use of an MDI with spacer. Indications: WALRI, wheeze associated with lower respiratory tract infections, asthma. Equipments for nebulization: nebulizer, connecting disposal tubes, mouthpiece for older children, face mask for infant, normal saline solution, drugs to be given through the nebulizer, 5 cc syringe. Steps for using the nebulizer: plug in the nebulizer to the mains and switch it on. Wash hands thoroughly before using a nebulizer. Make sure the equipment is clean and use disposable tubing and mask for each patient. Measure and put the correct dose of medication, 0.5 ml, to be administered into the nebulizer chamber or cup. If the medicine is in single-use vials, twist the top of the plastic vial and squeeze the contents into the nebulizer cup. Add normal saline solution to make the volume 3 ml using a 5 ml syringe. Connect the mouthpiece or mask to the T-shaped elbow. Face mask for infant and smaller children and mouthpiece for older children. Connect the nebulizer tubing to the port on the compressor. Turn the compressor on and check nebulizer for misting. Hold the nebulizer in upright position to avoid spillage. The infant or child should preferably be in the most comfortable position or kept in upright position or semi-inclined in the mother's lap. If using a face mask, ensure that it is well-fitting. In older children, ask the patient to keep the mouthpiece inside the mouth and close the lips around it. Ask the older children to take slow, deep breaths and, if possible, to hold the breath for up to 10 seconds before exhaling. Occasionally, tap the side of the nebulizer to help the solution drop to where it can be misted. Continue nebulization till the chamber is empty, approximately for 5 to 10 minutes. Reassess patient after 20 minutes and repeat nebulization if required. Troubleshooting. If the nebulizer is not misting, check the holes in the valve of the chamber for blockage. Holes can be cleaned with a disposable needle. Then check for misting. The electric wiring, plugs and socket may be checked. Compressor may not be working and may need major repair. Metered dose inhaler MDI with spacer and without spacer. Equipments for metered dose inhaler MDI with spacer and without spacer. Metered dose inhaler with cap. Canister. Spacer. Face mask. Using MDI with spacer. Check the expiry date on a canister. Attach the mask to the mouthpiece of the spacer. Remove the cap from the inhaler and shake the inhaler well. Fix the inhaler mouthpiece into the inlet of the spacer. Inhaler should fit snugly and without any difficulty. Place the mask over the child's nose and mouth so that it seals the face properly. Press down on the inhaler canister to spray 1 puff of medicine into the spacer. Hold the mask in place and allow the child to breathe in and out slowly for 5 breaths. If a single dose needs more puffs, press the canister again and advise the child to breathe. If a child needs another dose, it should be given as per doctor's direction. Using metered dose inhaler without spacer for older children. Check the expiry date on a canister. Remove the cap from the inhaler and shake the inhaler well. Ask the child to place the mouthpiece inside the mouth with lips forming a seal. Instruct the child or mother to press the inhaler and continue to breathe normally. Instruct the child to keep mouth closed for 10 seconds and breathe through the nose. Repeat the above steps when more than 1 puff is prescribed. Advise to wait 1 minute between puffs. This may improve penetration of the second puff dosage into the lung airways. Ask the older child to rinse his or her mouth with water after using the MDI. Recap the MDI. Cleaning of MDI and spacer. It is important to clean the inhaler regularly, about once a week. Otherwise, it may not work properly. Remove the metal canister and mouthpiece cap from the case of the inhaler. Wash the case and cap in warm soapy water. Rinse in warm water and then leave to dry. The outlet hole in the inhaler valve can sometimes become blocked. This can be cleaned with a needle. Spacer should be cleaned once a month in warm soapy water to prevent build-up of medicine residue on the inside. It should be left to drip dry rather than drying with a cloth. Drying with a cloth or cleaning the spacer more frequently than every month can cause static to build up on the inside of the spacer, and this can impair its performance. Key points to remember for nebulization. Make sure that the equipment is clean. Put the correct dosage of medication and add saline to make volume 3 ml. Ensure proper connection, tubing and seals. Check the nebulizer for misting. Occasionally, tap the side of the nebulizer for better misting. Key points to remember for MDI. Use spacer in infants and children since it improves the drug delivery and effectiveness. Ensure prescribed and correct dosage. Regular cleaning helps in maintaining effective drug delivery.